And welcome back. Well, pain is such an individualized problem, and you may have pain in your back, but how do you know what the real cause is behind all of it?
And joining us now to talk about it is Dr. Rani Chovatiya. She's an interventional pain specialist with Spine Pain Diagnostics Associates. Great to see you. Thank you so much. We were talking during the commercial break. A lot of people say, oh, my aching back. It's a very common problem.
Yeah, it is very common. Low back pain is the most common complaint amongst Americans and amongst other types of pain as well, but we manage all those in many different ways.
What exactly is interventional pain a specialist?
So an interventional pain specialist has undergone specialized training during residency and fellowship to perform different types of procedures, educated about many different types of pain syndromes, and to try and offer a multimodal treatments to these types of conditions. So whether it's through injections, medications, different types of therapies, using chiropractic and physical therapy in addition to all those things, that's been shown to be the most effective way to treat the pain. And we've been taught to diagnose the pain so as soon as a patient's having these types of symptoms, if they're able to come and see a physician, we can diagnose it as quickly as possible and offer an early intervention.
Well, the last time you were here, you were talking about some of the causes of low back pain. Can you remind us of some of the reasons why we experience pain in that particular area?
Yeah, absolutely. You know, there are many structures in the back, so there can be spine-related causes and non-spine-related causes, and we deal mostly with causes related to the back, related to the spine. So there could be issues with the muscles in the back, there can be issues with the joints in the back or the bones. There can also be issues with the nerves or the discs also in the back too.
When we talk about the low back, specifically the bones and the joints that are there, I think a lot of people think about pinching that sciatic nerve or something like that they've heard before. It's kind of a buzzword.
Yes,
are those things that are most common, or what kinds of bones and joints do we need to be aware of in the low back?
Well, the main joints that are kind of connecting the bones in the back, what are called the vertebral levels, they are called facet joints. And so these joints are covered with cartilage, so sometimes what happens over time, that cartilage can become or can degenerate, and this can cause inflammation, cause pain. There are also nerves that run along these joints, and those nerves can become inflamed, and so the patient can develop pain in that area, and there are different types of treatments that we can offer to try and manage that.
And is surgery usually what's indicated when you treat lower back pain?
It can be, but you typically want to try and maximize conservative therapies before going down the route of surgery, because surgery doesn't necessarily guarantee that the pain is going to resolve completely too, and it can also introduce an unnecessary risk, especially if the patient hasn't tried other types of therapies beforehand. So that's where we kind of come in, and we can offer, you know, having this being my area of expertise, we can offer different types of medications and procedures that can help alleviate the pain so the patient may not have to undergo surgery.
I feel like people get very confused when thinking about where to treat their back. They think of physical therapists, they think of chiropractors, they hear of a pain specialist.
Right.
How do you sort of differentiate between the three, or do they all work together?
You know, we all work very well together. You know, each has a different area of focus and a different way that they approach the pain problem. It is important, however, that a physician at least be involved in some regard, just because we've had a specialized type of training, and in case the pain is related to something that's more serious or of some more of an underlying condition which needs to be addressed right away, a physician can intervene right away and at least refer the patient to an expert so the pain or the problem can be managed appropriately.
Some people have chronic pain in the lower back, and maybe they've tried different procedures or seeing different people to try to alleviate the pain. What do you suggest if someone says, I have low back pain? What's the first thing they should do?
Well, the first thing they should do, I think, is talk to their physician, whether it's their family physician or even contacting a pain specialist. Because like I said, if this pain has been persistent, if it has been going on for a long time, it shouldn't go unignored, and it should be treated right away. It's sometimes by ignoring it for a long period of time, you know, damage can be done, irreversible damage can be done, and so then the problem can't be treated properly. And typically we'll ask specific questions about, you know, how long the pain has been going on, how the patient describes the pain, is it interfering with their ability to do their daily activities, order, you know, x-rays or MRIs that can possibly assist us in making the diagnosis, and we use all that information and figuring out a treatment plan specific for the patient.
Do people need a referral?
No, they don't need a referral. They can call us at our clinic, and I'm sure you guys will show that information a little bit.
Yeah.
But you know, they can call and make an appointment and talk to our staff, and we work with many different insurance carriers in addition to Medicare, Medicaid. So if there are any specific questions in regards to whether certain procedures or certain visits are covered, we can definitely answer that.
And wonderful that you have all the different therapies available to people, that it's not just one, you know, one treatment or solution for everybody. You combine all these different modalities to kind of get the most effective relief for pain.
And that's been proven to show that, you know, a more longer term relief for the patient. So doing just one thing by itself, just doing medications by itself, or just doing physical therapy by itself, you know, may not be effective, especially if the patient's still having pain after just trying that one thing. So by doing all these different things at once, we can just kind of nip it in the bud and move forward.
Well, let's be honest, when you're having back pain, you just feel desperate for it to go away. So I think it's important that people contact you. Here's the information. So you can connect with Spine Pain Diagnostics. You can visit them online at paindiagnostics.net, or they're located on Port Washington Road in Mequon. That's where you can also find Dr. Chovatiya. The phone number to call for an appointment is 262-478-0301. Thanks so much for being here.
Thank you.
Thanks for having me.
Great to see you again.